In public health, the world's population is the patient. From the smallest village in Africa to the bustling cities of Asia to the streets of Los Angeles.
We are interconnected. We're interconnected in the things that make us sick. We're interconnected in the consequences of those things, and we're interconnected in the solutions.
We breathe the same air, eat from a common food supply, and together face health risks unimaginable decades ago, from bioterrorism to global warming.
The violence of our weather will increase dramatically. Typhoons and other kinds of events will have major health impacts, and droughts will be far more severe. We are looking at as many as 500 million people dying as a result of this.
From pollution to the threat of worldwide pandemics.
We tend to think of wars as having been the biggest mass killers in human history, but in fact the biggest mass killers have been infectious diseases.
Today, a virus can migrate around the world in a matter of hours. We've seen it happen with H1N1. Now UCLA's new global biolab will be able to track outbreaks.
This is really important.
If we can have a system where we can quickly identify the problems and quickly respond, we may be able to get ahead of the epidemic curve and to be able to stop pandemics before they start.
UCLA's faculty is working in the United States and in more than 70 countries around the world, conducting research and forging partnerships to bring services to underserved communities, where being poor is a leading cause of ill health and early death.
We don't do things for people. We actually give them the tools so that they can help themselves.
By teaching the benefits of nutrition and exercise.
If we don't do something to stop the bleeding, if you will, we're going to end up with probably 90% of the population that's overweight or obese. It's already up to 2/3 now.
Public health interventions have added 25 years to the average lifespan last century by giving us clean air and water, safe food, and immunizations.
What's wonderful about public health is that when it does its work best, it does it invisibly. We're not aware of the bad air we're not breathing or the bad water we're not ingesting.
The problem is there aren't enough public health professionals.
There's a shortage of trained people in public health at a time when public health is increasingly recognized as the key driver for how we're going to improve health and reduce disparities in the world.
That is the challenge. In order to avert a crisis, 3 times the number of public health workers will have to be trained over the next dozen years.
UCLA enables me to look at my passion in terms of social justice and public health while being trained very rigorously, and that's something that I really appreciate.
Our responsibility is not just to train all public health workers, but to train the leaders of tomorrow.
Leaders and doctors capable of saving lives not just one at a time, but millions at a time.
I'm not making a case, let's build a beautiful, safe, healthy world for our children. I'm talking about being here for me as well. We're here right now. We have to start reaping the benefits of being part of this wonderful story called humanity.